Record. Oh, it told me that they were recording. My name's Dorian Chalmers, and I'm the president of the Minnesota Lyme Association. So I'd like to welcome you here today. Just to let you know a few things coming up. So next Tuesday on June 15th, we have a support meeting. We won't have any more presentation meetings for the rest of the summer, just because it's summer and it's a little harder to get people together. So July 13th, we will have a support meeting, and August 10th, we will also have another support meeting. Then we'll be back to doing some presentation meetings starting in September. If you have not gotten any e-blast from us telling us about, to tell you about these things, you can go to our website, mnlyme.org, minlyme.org, and on the homepage down at the bottom, you can just put in your email address, and then you will be subscribed, and then you'll get notifications about all of our events and meetings. So wanted to let you know about that. So without further ado, I'd like to introduce the beautiful and wonderful Stephanie Belseth. She is a physician at Newbridge that specializes in pediatrics. And so I'm gonna let Stephanie take this away, and thank you again. We're so happy to have you, Stephanie Belseth.
Thank you so much. I just want to double check. It says that my screen is sharing. Can you guys see my PowerPoint?
Yes.
Okay, I'm going to put it into presentation view then, and we'll get going. So, all right. So, welcome everybody. I'm really excited to be speaking to you tonight. I do have to clarify, I'm actually a pediatric nurse practitioner. I can do everything physicians can do except surgery, but I am a pediatric nurse practitioner. So I've been in pediatrics for 30 years, and I've always really gravitated towards the underdog in my practice. When pediatric HIV was a thing, I was really drawn to that and wanted to help those folks. And as I've gotten into more functional medicine, I really enjoy helping people that are not well served by others, and that can really see a lot of improvement with the right approach. And Lyme, PANDAS, ANS, PANS, all kinds of different conditions that are not well understood that are actually treatable. So we're going to talk tonight about Lyme triggered PANS and ANS. So basically, the PANDAS was coined maybe 25 years ago by Sue Sweda. We'll talk a little bit about that. It's the pediatric autoimmune neuropsychiatric syndrome associated with strep was the original PANDAS, AS associated with strep. PANS can be associated with any infection. And at first it was thought to be only a pediatric illness, and then basically thought to be really, possible to see in older adolescents and adults. And now the term ANS has been coined. I do have to give a little medical disclaimer, just saying if there's Q&A or anybody asks for any personal advice, just a medical disclaimer that you always want to seek the advice of your own physician or nurse practitioner or other qualified provider with your own personal history, but I'm happy to, at the end, answer questions and give my wisdom to anyone who is interested in my approach. So we are in the midst of a pediatric and adult mental health epidemic. We've never seen brain disorders as high and mental health issues as common as we are seeing today. And part of that, I do believe, is due to vector-borne illness and our environmental milieu that we live in nowadays. Complex, but we'll go into that. And we see autism rates climbing. We see rampant anxiety and depression and OCD and increasing psychosis. A very sad statistic is the pediatric suicide rates have tripled in children ages 10 to 14 between 2007 and 2017. I mean, 10 to 14-year-olds, these are babies, and they're, the suicide rates have not just attempts, but the actual success rates have tripled in that time frame. So we know that there's a huge need for care for mental health issues and physical health issues. And PANS and ANS really comes out as, mental illness that's triggered by physical issues. And we're going to talk about that. And one of the big ones is Lyme. So functional, biomedical, integrative, multidisciplinary approaches can help heal these disorders for kids and adults. And I'll share with you the path to healing today so that you all can maybe learn something new. This article is back from 2013, and it just is showing that neuroinflammation, inflammation in the brain, triggers psychiatric illness. So most of the Lyme patients that I treat and know have a component of physical illness, fatigue, joint pain, kind of comes and goes, where they can work and go to school and do things, and then other times where they can't. But there's always a component of anxiety, depression, brain fog, executive function problems, some ADHD symptoms. There's always some kind of mental health issues involved in the majority of my patients, at least. I know there are some classic Lyme patients that just get the musculoskeletal kind of symptoms, but most, I believe, at least most of the patients I see have a mental health psychiatric side too when Lyme infiltrates the nervous system. So basically, this article was just confirming that psychiatric symptoms or mental health symptoms can be triggered by brain inflammation, which really is a novel kind of thought in the field of medicine, where historically people have just thought it was genetics or, bad luck. So, or maybe life stress, which certainly all of those things can, play into it, but it's not usually the full story. So tonight we're going to be talking about what is PANS and ANS, what a typical presentation looks like, triggering infections and predisposing factors, the path to healing. And I won't be going into the whole path because there won't be time, but I'm going to target some areas that sometimes are overlooked so that we can focus on those. We'll talk about some complementary modalities, some case studies, and then we'll end up with question and answers. So, and I will say that this talk is really on PANS PANDAS. I do have an earlier talk on the Minnesota Lyme website on page 2, if anyone's interested in looking at least a few years ago what my approach to Lyme was at that time. I'm always going to lots of conferences. I love to learn new things that will help my patients. Because I'm a little OCD in trying to get all my patients 100% better. And we need more tools in the toolbox. So I go to probably 2 conferences a month. It's been great with COVID. I can go to a lot more online without having to travel. But I do take things I learned from other fields and diagnoses and apply that to patients that I see. So I'll be incorporating a lot of different things in to my presentation today. So PANDAS, it was the first diagnosis that came about. Sue Sweeto identified it about 25 years ago. And that's the pediatric autoimmune neuropsychiatric syndrome. And that, her first identification was associated with strep. And the news of the day is that it isn't only triggered by strep, and it doesn't only impact children. We see that many other infections can trigger these psychiatric symptoms, and adults can suffer from them too. The adult version is now referred to as AANS, which is Adult Autoimmune Neuropsychiatric Syndrome. And I'm so happy that this is getting greater recognition. There was just a conference a couple of weeks ago that I attended, sponsored by the Neuroimmune Foundation, and that's a nonprofit trying to get the word out there into Western medicine and everyone really that infections can cause chronic illness and they can cause chronic mental illness. And I think COVID is actually doing us a favor in that we're seeing people get COVID and we're seeing that they have this long hauler, this prolonged post-COVID syndrome that can cause both physical and mental health issues. And I think that that's going to be really helpful for Lyme because we see the same thing happening in Lyme. So, so I think that there's a lot of hope on the horizon for perhaps more recognition and acceptance of people suffering with chronic Lyme and PANDAS and ANS and ANS and PANS. Got one extra ANS in there. So PANS versus PANDAS. PANDAS is really associated with strep. We see a lot of obsessive compulsive and anxiety symptoms in these kids. They usually come on very suddenly after a strep infection. So the child gets strep, their immune system has a misguided attack, and those antibodies that are produced by the strep cross the blood-brain barrier and they attack the brain. We can find that other infections can cause the same trigger. And PANDS is the pediatric autoimmune neuropsychiatric syndrome, not necessarily associated with strep. So that can be associated with Lyme, with mycoplasma, with viruses, with many, many different things. And what I've been seeing these individuals I've been recognizing PANDS and PANDAS and AANS for about 10 years, and treating from a functional medicine perspective for about 15 years. And what I've learned in that time of treating Lyme and PANDAS, et cetera, is that the Lyme triggered PANDS individuals, there's more psychosis, more fatigue, and Lyme and co-infections are really the #1 contributor to PANDS, at least in Minnesota. I think partly we have a lot of Lyme here. In other parts of the country, there may be other infections that are more prevalent. When we have strep involved as a trigger for PANDAS, we generally see more vocal or motor tics. I don't see as many tics where someone might have eye blinking or shoulder shrugging, or they have to move in a certain way. There may be some choreiform movements where they have these wave-like movements of body parts. I don't really see that with Lyme as much. I'm seeing that more with PANDAS. But OCD, tics, anxiety, getting worse. Some of these kids can be totally normal, and then the next day they're off the cliff. So, but other people have a little bit of a slower, steadier, kind of onset. And I tend to see in my PANS patients, it's not always quite a sudden onset. But I think what we've been calling neurologic Lyme for a long time is now being recognized as ANS and PANS. And actually, that's a good thing, because I feel like there's a little bit more acceptance for ANS and PANS out there in the world nowadays than chronic Lyme. So it might also bring more acceptance and treatment for patients suffering with this syndrome. So really what this is, it's an autoimmune encephalitis. So basically we're seeing that the brain is inflamed and it's not functioning well. And particularly in PANDAS, we see the basal ganglia, which is located deep in the brain and is kind of a switching station. And it sorts, kind of manages movement, cognitive perception, habits, executive function, logic-based thinking, emotions, reasoning, task flexibility, motor and traffic control, and the endocrine system. So if that's inflamed and not functioning, none of those things are going to work right. And we see with Lyme that even more areas, Lyme-induced autoimmune encephalitis is, even impacts more areas of the brain. So we do see that dopamine exerts a significant effect in this striatum, which is the major input center of the basal ganglia. And not surprisingly, these individuals have a lot of problems with dopamine, attention focus problems, lack of motivation, difficulty, finishing things, being organized, prioritizing, all of that kind of stuff. So the history of PANDAS, which is really considered an orphan disease, we didn't see symptoms of PANS and PANDAS or ANS, prior to, 1998 was when Susan Sweeto, the pediatrician at the National Institutes of Health, first identified it. She got a lot of backlash back then because people didn't believe that a physical ailment or an infection could cause mental health issues. We obviously know that they can, but back in the day that was thought to be not true. And even today, unfortunately, there's a lot of people out there who don't believe that. In 2008, Lombroso and Scahill, two different researchers, described 5 diagnostic criteria for PANDAS involving the sudden onset of anxiety or OCD associated with other symptoms such as enuresis, new onset ADHD, all kinds of symptoms, but kind of following a strep infection was the focus at that point. In 2012, the criteria were revised, and there's new PANDAS guidelines, 3 separate published articles published in the peer-reviewed literature, established by the National Institute of Mental Health. And that was in 2012. And then in 2017, the criterion guidelines for PANDAS were updated and published in the literature. So nice background there. And it's really been more, I would say, in the last year or two that Lyme has been seen as one of the triggers. Brian Fallon at Columbia University has been helpful in that area. And, just the ongoing efforts of ILADS and all of the different integrative medicine specialties that are focusing on patients with chronic Lyme and PANS, ANS, and PANDAS. So the age distribution in PANS, PANDAS is, about 11% are diagnosed between 1 and 3 years of age, 69% diagnosed between 4 and 9 years of age, and then 19% between 10 and 13. At the time of this, which was several years ago, they only classified 1% at 14 and older. This was based on like 700 family self-reports. Don't know for teens and adults. There's not been really good studies on this since then, but I see a plethora of teens and adults with this syndrome, and it certainly is not limited to children. So the typical presentation is that in kids, I might see a toddler or preschooler, with a history of kind of just being really irritable, being hard to soothe, having kind of more separation anxiety than normal. But overall might get over that and do just fine. But then at some point later, they have mental health symptoms that explode, and the child suddenly gets much worse with new onset anxiety, OCD, separation anxiety. Sometimes they start wetting themselves. They might have new onset ADHD symptoms that they never had before. They may have new onset executive function problems, anger, irritability, handwriting changes, phobias that were never there before. I mean, the stories are just heartbreaking that I hear every day, but fatigue, sleep issues, etc. And symptoms often relapse and remit, much like Lyme, and they're oftentimes worse between October and April. And then at some point they have full-blown PANDAS and the above symptoms, but more severe. And when the longer they go without treatment, just like the longer people with Lyme go without treatment, it can advance to, much more serious issues. So one of the issues that I see is something called Avoidant restrictive food intake disorder, ARFID, where these individuals just can't eat. They feel nauseated, they feel like everything makes them sick. They have sensory issues with certain foods. The thought of eating certain foods are a problem. The thought of eating foods in public are a problem. And they start losing weight, and it's an atypical anorexia. This typically happens when people have had this for a longer period of time. It's certainly not a common thing, but I do have many, many patients that are dealing with that. There's suicidal ideation, hallucinations, psychotic symptoms, anger, aggression, dystonia, misophonia, hyperacusis, debilitating OCD, and loss of cognitive function. So a lot of overlap there with Lyme. ARFID, the restrictive eating, is more than just picky eating. It can really cause serious health issues, malnutrition, failure to thrive, and growth issues. And if people don't have the macronutrients and the micronutrients that they need, their bodies really can't heal. That's why nutrition is just so important in healing chronic Lyme, PANS, ANS, PANDAS, etc. One difference here is that ARFID patients are not concerned about body image. So whereas typical eating disorders, patients have body dysmorphia, they think they're fat, they're concerned about getting fat. These kids don't see that. They don't have body image issues. They just can't eat. And I think that this is in a way an attempt by the body to help heal, because fasting, which I'll talk about a little bit later in the presentation if we have time, starves out these infections. So I'm a big fan of fasting. I intermittent fast regularly, and at least once a quarter I do a 5-day water fast. The longest fast I've done is 14 days water fast. So if any of you ever want to talk to me about fasting, it's a great way to kill any cancer cells that might be in your body. It's a great way to kill Lyme. It's a great way to reboot your immune system and get your immune system, more balanced. It can reestablished, normal immune function in autoimmune patients. It's reversed diabetes in patients with, full-blown autoimmune diabetes. So there's lots of benefits there, but I feel like the ARFID that happens in these individuals is maybe a body's secret attempt to try to help them in a way. Although if they're not being treated, ends up hurting them. So there's certain psychological symptoms and physical symptoms that I won't go into here, but is an issue. I wanted to share with you because I don't think there's really any way to understand this, or at least the better way to understand it is to, watch a video. So this is the trailer for a documentary called My Kid Is Not Crazy. And just know we see this same kind of stuff in adults, presents maybe a little differently, but a lot of people have this at all ages, to be honest with you. So I am going to play this trailer, and hopefully everybody will be able to hear it.
We're in exactly the same position about a decade ago.
Are you guys seeing this?
We can see it. Is there any sound?
Oh, you're not hearing it? Oh,
Mm-mm.
darn it. So there is sound on my end, but you guys can't hear it?
Can't hear it.
No.
Okay. All
When-
right. So this
When you're sharing the video, you have to check the box in the sharing window that says allow my computer sound to throughput.
Okay, let me try this one more time. I am sorry, this is not my forte. Let me try this. You know, I may have to have you guys get the URLs, because I'm not seeing here where it can allow me. Maybe it's under more. It's not giving me a pop-up. Share computer sound. Maybe this will do it. Okay, let's try this again. Thank you for your patience, for my lack of technical skills. I used to be able to embed these in PowerPoints, but then there was some licensing thing, and I don't know how to do that anymore. Can you?
I think that we were in exactly the same position about a decade ago, even 5 years ago. We repeated the
Anyone able to
experiments
hear it?
over and over again, demonstrating this connection
perfect.
between the strep and the OCD. Probably the most effective of those experiments was using antibiotics to keep the children from getting strep and showing that that kept them from getting their OCD and tics back.
I suppose there are some people who think new ideas are ugly because they're threatening. I never wanted, nor could I have ever imagined that I would be at the center of a controversy because we just were doing our job.
It's like a seizure. It's like watching your child be attacked by a ghost.
This is not my daughter the way she was like a couple weeks ago.
He's going to pick things up and he's going to throw them. He's going to, spit at people. He's going to spit at people.
Kids are not supposed to be perfectly healthy one day and then completely tormented and very psychiatrically ill the next.
She recognized that you can have obsessive compulsive features that come on following an infection.
Doctors linked Maury's obsessive compulsive behavior to a common ailment in children, strep throat. The likely relationship has been coined PANDAS.
Anytime a new idea is propagated, there is an opposition to that idea because it takes people out of their comfort zone.
It is controversial. The concept got out of control. Every child who had no onset of tics was getting a course of antibiotics.
And I don't really believe that antibiotics help OCD.
Why is half of this medical community so against this research?
It's this great abyss between the medical system and the psychiatry system.
I see this inflammation. It doesn't tell me that this is psychiatric. It tells me this is an organic disturbance in the brain.
There's just no one in our town who knows about PANDAS, who's been willing to be open-minded to it being anything except psychiatric.
One of the things that really sucks, it so sucks, because you're so tired every day to read papers and understand stuff and talk to doctors and say, listen, figure this out. I'm too tired to read this shit and explain it to you. Just do something for my kid. Do something.
So sounds familiar to a lot of us, right? The full movie is out on Amazon Prime and other venues online. A lot of commonalities between chronic Lyme and PANDAS in the lack of acceptance in the medical community, although it is getting better. This next trailer focuses a little bit more on an older individual with the same issue. And this documentary is called Brain on Fire. And I'm going to play this for you as well. And I hope that this one.
My name is Susanna Cahalan.
Can you hear this one?
I'm 21 years
Yep.
old, and here I am with my dream job at the New York Post.
Gross. Why are you smiling this early in the morning? It's unnatural and disgusting. You look ridiculous.
Susanna! You're gonna interview that creepy senator.
We'll have a Thursday night.
I know I will, because I can always count on you.
I had my whole life in front of me.
Happy birthday!
And I had absolutely no idea what was waiting for me.
Susanna, where are you? You're very, very late. You gotta get your ass in here. You're gonna miss the 10 o'clock meeting.
I feel really sick, my head hurts, my stomach hurts, and my hands numb, and I've never felt like this before.
We've tested Susanna for every infectious disease. All of the results are negative.
We're gonna get to the bottom of this together. Her EEG is completely normal, her MRI is normal, her neurological exam is normal, it's all normal.
Her condition continues to regress. Manic behavior, paranoia.
Each of them is giving us a different diagnosis. One is saying bipolar, next one is saying schizophrenic, then they're saying psychotic.
We should look at hospitals that are better equipped to deal with her.
Just take the pills.
She needs all of us.
You look fine, the answer.
Her life is in your hands. Tell me, what is wrong with my daughter?
You must be the famous Susanna.
I'm scared.
I know she's still in there. She's just trapped. I promise you, I'm going to do everything I can to find you.
No, God, no.
Time is of the essence. We are losing time.
So, these are the pictures of ANS and PANS. A lot of you can probably relate. And it always makes me really teary watching these kind of things, because just the suffering that's out there, and so many people that don't know what's going on, are not diagnosed appropriately, are not treated appropriately. And if we could treat some of these conditions early, people's whole lives would be changed. So that's part of what we're trying to do at Newbridge, is diagnose and treat people early, and get people the right treatment so that they don't have to go on and suffer. So there is treatment, though. I mean, there's actually amazing treatment, and you can turn these things around. And the second trailer, to me, I haven't watched the whole movie, but looks a lot more like Lyme, as a trigger or co-infections. So that is another one. There's a lot of infections that can trigger PANS, ANS, and PANDAS. Strep was the first diagnosed. Borrelia is a big one. Bartonella is huge. I see Bartonella is probably even, more common, or as common at least as Borrelia burgdorferi and other strains of Borrelia. Lyme co-infections can be significant. I have a Rocky Mountain spotted fever patient who has these classic symptoms right now. And we do have Rocky Mountain spotted fever in Minnesota. I had an infectious disease doctor tell one of my patients that we don't have Rocky Mountain spotted fever in Minnesota. And this particular patient has never left the state, was bitten by ticks several times, and has a, CDC positive, Western blot, or actually IgG, IgM testing positive for Rocky Mountain spotted fever. So it does exist in Minnesota, and I actually see a fair amount of it, in addition to tick-borne relapsing fever and many other co-infections. Mycoplasma is a super common one. Coxsackie viruses are one that some people really are triggered by. COVID, since COVID is, we're all out and about more, and kids are back in school more, and we definitely are seeing COVID as a trigger for PANDAS, PANS, and ANS. Oral spirochetes. So sometimes when people get their teeth cleaned or some dental work done, people can have a flare, and due to the disruption of oral spirochetes in the gums and the gingiva, viruses in general can trigger. So the longer you have this, the more things will trigger you. So if you started with just, strep, Over time, multiple things will start to bother you. And so really all cases are really PANS or ANS. There's really not very many classic PANDAS cases, because over time I find that, it's not just strep. On the other hand, some people start with Lyme, and that is their original trigger, and then eventually go on to have a strep, and all the others cause a problem. And sometimes strep isn't the issue, but there's a variety of infections that can trigger. So predisposing factors are oftentimes elusive to figure out why am I dealing with this? Why is my family dealing with this? Why do I have this going on? My brothers and sisters share the same parents. They don't have any issues. Why do I have a problem? We're trying to figure out what the predisposing factors are so that we can prevent this. And I am finding increasingly, and many of us in the field are finding increasingly, that mold and mycotoxins are at the top of the list because of the fact that they suppress the immune system, and then the immune system starts to go down this hyperreactivity and autoimmune response pattern if you have that genetics and that microbiome that predisposes you to that. And then, everything just goes out of control from there. We also know that electromagnetic radiation, also known as EMF, can be a predisposing factor. We know that triggers a leaky blood-brain barrier, and then the antibodies to infections or the antibodies to foods or many other things, toxins, can cross the blood-brain barrier and cause more damage. So toxin exposure, heavy metals, chemicals, pesticides and herbicides, glyphosate, which is the main ingredient in Roundup, all of those things can be predisposing factors. In addition to blocked drainage pathways, if someone's constipated and they're not pooping, 1 to 3 times a day and clearing out what they ate on Monday and Tuesday and getting their system cleaned out, and their lymph system isn't draining because they're not moving around much, or they're just so inflamed, their lymphatics in their brain aren't moving, their liver and gallbladder are all sludged up. When you start killing infections, or you have an accumulation of mycotoxins produced from mold, you will not be able to clear those out, and you just recirculate them and will get more sick. So, in terms of the well-known Herxheimer reaction, people really shouldn't have Herxheimer reactions if their detox pathways are open, if you're killing infections in a slow, graduated manner, and you have the right support on board, antioxidants, binders, things like that. You really should be able to treat these infections without those Herxheimer die-off reactions. Or if you have one, you can abort it and go down a different path and end up, getting better without having to go through that. Because it's actually not good for the body to have that happen for very long, because that's, inflammation, a cytokine storm, and that's just going to slow down the healing process. For some people, they have ancestral in utero or early childhood trauma, the ACEs, and we'll be talking a little bit about that study in a little bit. People can have dysbiotic microbiomes that create their immune system to be in such a place that it can't respond normally to infections and is more slanted towards autoimmune responses or hypersensitivity responses. Stress and trauma can be as toxic as mercury. And so dealing with that is important. And then just poor nutrition, sleep, and lifestyle. Those are all predisposing factors that make one person be more likely to become ill than somebody else who doesn't have some of these stressors. So if you or your child is sick, I'd encourage you to look at all of these issues, starting with mold and EMF, and take care of that, because at that point, then you'll be able to start healing if those are issues for you. So we know that mold toxin exposure during pregnancy can have a significant effect on the child and then growing up into an adulthood. The medical literature is beginning to examine the effects of mold and mycotoxin exposure on the unborn fetus and in young children. And the mycotoxins are small ionophoric molecules that are both fat and water soluble, and they they're thought to easily diffuse through the placenta. We need more research on it, but I do see that my babies born into to mothers and fathers who conceived and carried the pregnancy in a toxic environment with mold and mycotoxins. Those babies always have problems. Some of the sickest and most unhappy babies that I see. So there's a lot of comments here about what that can look like, but This is an article published in 2018 about the effects of mycotoxins on neuropsychiatric symptoms and immune processes, not just in children, but adults as well. And mycotoxins are really problematic. The reason why I think we're hearing more about this now than we did, even 10 years ago, is that electromagnetic radiation exposed to mold makes the mold create 600 times more mycotoxins than mold that's not exposed. So there was a study done where they took a toxic type of mold, they covered it with a Faraday cage so that the radiation wouldn't reach the mold. They had the same species right next to it, open to the exposure from cell phones, wireless, Bluetooth, Wi-Fi, satellites, etc. And that radiation exposed mold created 600 times the toxins than the mold that was shielded from the radiation. So in the advent of cell phones, computers, laptops, everything that we didn't have 25 years ago, or even 20 years ago, or even 15 years ago, now we're all bathed in it, and it's getting more and more and more every minute. We have 5G now, which is a totally different type of radiation, and we're getting new satellites put into the upper atmosphere, every time you read the paper, and it's hard to get away from it at this point. So we have to have some sanctuaries in our home, like this. The bedroom needs to be a sleep sanctuary that absolutely has no EMF. Since we're getting exposed so much everywhere else, we need to have time at night to rest and recover and heal. And that's really hard to do if we're getting bombarded with EMFs all day. And then we get the mycotoxins expanding. With Lyme disease, we know that Lyme does the same thing as mold. There's not the published research on it yet, but there have been, Dr. Klinghardt and others have done some research and found that that is indeed true. And I think that's one of the reasons why our Lyme patients are so much sicker. And have a harder time getting better. And so making sure you're not living in mold, making sure you're dealing with mycotoxins, making sure that you're getting your computer hardwired. I'm hardwired connected. I have my laptop on airplane mode. So I'm not getting bombarded from Wi-Fi right now in my home office here. I'm hardwired, and that is okay to use. So it's not like people have to stop using technology. You just have to set up a smart workstation, get a little adapter that plugs into your charging port of your iPad or your phone or whatever, and then have that connecting to a little converter that goes into your Ethernet cable in the wall that you may have to have installed. You just have to call your cable or your internet provider and say you want to have that connected. You, in some cases, may have to find out what the best way to do that is, because every home and situation is different. But we did it in our house. It really wasn't expensive, and has really helped quite a bit with just overall health, sleep, and that sort of thing for many, many people. So one of the big things to do when we're trying to figure out what's going on with these individuals is that we have to do some testing. We have to figure out what's going on, because there are so many infections that can trigger, and what people think is Lyme isn't always Lyme. What people think is strep isn't always strep. What some people think, is chronic Lyme could be more a problem with mercury toxicity by the point they're getting treated. It could be more of a problem with mycotoxin exposure or electromagnetic hypersensitivity, and the Lyme is just kind of a bystander. Or other infections. Many times it is the number one thing, and then it causes all the other cascade of problems. But what I have found is that you can't get chronic Lyme patients or Lyme-triggered PANDAS or AANS patients better by just focusing on killing the infection. That's only part of the treatment, a very, very important part, but you have to also do all the other surrounding pieces. So there's standard labs that I just had on the screen. There's other testing recommendations here. One of the keys is to do the autoimmune brain antibody testing so that we can find out what is going on in the brain. Do we have dopamine 1 and 2 receptor antibodies that are attacking our dopamine receptors, or do we have antibodies attacking the basal ganglia, et cetera, et cetera. So the Molecular Labs Cunningham panel and the Vibrant Labs Neural panel called the Neural Zoomer are both great tests to determine some of that autoimmune brain attack. Urine mold and mycotoxin testing, the mycotox test from Great Plains or the real-time testing, or both are really helpful. Organic acid testing can show aspergillus metabolites. It's a urine test. There's testing for nutritional deficiencies, which can impact healing, metals, chemicals, pesticides, other toxins. And also looking at, are these toxins a current exposure in the last few weeks, like might be in the bloodstream, or is this, are we also assessing the total body burden? What has this person been exposed to in utero throughout their whole lifetime that may be impacting? And I mean, for children, one thing that I think is interesting is that the kids I'm seeing in my office, their toxicity is not only related to their mother's toxicity, but their father's toxicity and their parents' toxicity. Because when a mom is holding a baby in utero, carrying a baby, that baby, if it's a girl, has all of her eggs there. So that grandmother and her total body burden of toxins that she's been exposed to gets transmitted to that baby and to her eggs. So it's more than one generation's impacted by our toxic burden. So, and a lot of times I've had people, we treated everything got better. We've done all, everything got better on the testing, but their symptoms were still not totally better. And sometimes it's that you haven't really gotten all the toxins out, you haven't really gotten all the mold out, that there's something you're missing oftentimes, or there's maybe some trauma that you haven't dealt with. So it's really important to, look at everything in order to get people better. I used to just see the folate receptor antibody results coming back positive in autism patients. I'm now seeing them start to come back in some of my PANDAS patients. So it's an autoimmune attack on the folate receptors in the brain. And if you don't have folate in your brain, you're in trouble. So once we have one autoimmune disease, we are much more at risk to develop another autoimmune disease. And Lyme is very classic for triggering autoimmunity or contributing to the development of it. So one of the goals of treatment for PANS and ANS or chronic Lyme is just to prevent other autoimmune disorders from occurring, not only to heal the current autoimmune condition, but prevent more from occurring. So one of the assessments that I do in my practice is the NeuroQuant MRI. And this can really reveal helpful information in terms of underlying pathology and location of the brain, which can the brain inflammation or the atrophy, which can help improve treatment recommendations, help us monitor progress, and help kids and adults heal. So the NeuroQuant, and this test here is the triage brain atrophy report, and you can't really see the numbers, but you can see the pictures of the brain on top, which is just a traditional MRI. You can have them done at a couple places here in town, but they have to be ordered a certain way. So you have to order the MRI with the NeuroQuant, and they have to be done real time at the centers that do them. For this patient, the blue areas that are highlighted are 2 standard deviations above the mean, looking at the right and left hemispheres. And the red line is actually atrophy or damage to the brain. So it's 2 standard deviations below the mean. So red is atrophy, blue is inflammation. And this is based on comparing the person who had this test done to thousands of peers of the same age and gender who are healthy, neurologically, physically, mentally, and comparing their volume of their different brain areas to the volume of their peers. And that's how this volumetric assessment is done. And it really helps us understand what's going on in the brain. And I can't tell you how parents are always just in a way, they finally feel understood that, okay, their child is acting this way. There's a reason, because the area of the brain that's inflamed is the exact area of the brain that the child is exhibiting symptoms in, or areas. So I tend to find that this is really helpful, and it's a good tool to allow us to test it, and then a year later test it again to make sure that we're seeing the improvement we want. Insurance companies won't offer coverage for it very often, but it is billed just like a regular MRI. So it's pretty easy to get it covered by insurance. We also do 19-channel QEEG brain mapping, and this provides a real-time picture of how the brain is operating, how the neurons are firing, what brain waves are in the correct expected pattern and which are dysregulated. So, this is really helpful for us to prepare treatment programs for neurofeedback and neurostimulation and neurotherapy. It's also, we use it as a quality assurance measure, so we can offer it at a steep discount for people before and after treatment, or even every month as they're going through treatment, so that we can kind of figure out, are we going about this in the right way? Are we seeing progress? If we're not seeing progress after a month of doing a particular therapy, then we probably need to change therapy or change course or do something different. because we want to make sure we're getting continual improvement. So we also do genetic testing. So there are significant genetic single nucleotide polymorphisms to consider in many different areas. The methylation SNPs are paramount because if you're not methylating well, you won't be detoxifying well, you won't be having the neurotransmitter support, which is going to be a lot easier to happen correctly if you have good methylation status. You won't be having the immune support. Your immune system is not going to be as strong if you're not methylating correctly. And so we see that methylation impacts, major factors. There are many, many, many other ways that methylation, excuse me, problems can come out. But if we understand what's going on, if the person's undermethylated or overmethylated and can address that, that can help in the healing. You don't want to treat methylation too soon. You want to get inflammation down and get the infection kind of started to be treated before you do too much methyl support, because if you add too much methyl support, sometimes the patients can crash. So there's kind of a time and place for treating all of this. SNPs that are involved in immune and autoimmune related issues. The voltage-gated calcium channel SNPs are really important. We see that those are especially important in electrical sensitivity. So we have, kids in the practice that are homozygous for this, and they really can't handle the distance learning. They can't handle the EMFs and the Wi-Fi, and do so much better if they're out in the woods away from it all. And when they're exposed for longer periods of time, they really become emotionally dysregulated and cannot handle life. So if your child or you have that SNP, it's even more important to protect yourself from exposure. But the EMF exposure is harmful for everyone, not just people with these genetic variants. Detox and transsulfuration SNPs are important. Mitochondrial SNPs are important. Dopamine-related SNPs and SNPs that predispose to rheumatic fever, especially significant in PANDAS patients where strep is involved. Many, many more, but these are just a few that I look at. So here's the voltage-gated calcium channel variant that we check. It's the CAC NA1C gene. And when you have calcium channel ionic problems, you'll have a lot of problems with the electrical activity of the cells, the cell-to-cell communication, tensing of muscle fibers, muscle contraction, the regulation of certain genes. So the non-thermal microwave lower frequency EMFs act via the voltage-gated calcium channel activation. So something that's important to know if you're not getting better or if you're having problems in that area. So as I mentioned before, we need to look at a comprehensive treatment option. So not just the allopathic treatments, not just integrative or complementary treatments, not just emotional, counseling kind of psychologic treatments or environmental medicine treatments. We have to really combine it all in order to get better. At least that's what my experience has been, because we tend to see the more complex chronic patients at Newbridge, or at least a subset of them. So you need to kind of look at it more comprehensively and really need to support the whole body. We need to decrease inflammation. We need to really find those root cause triggers, correct them, decrease the immune dysregulation, need to treat the infections, need to detoxify and reduce the autoimmune activation. And when we can modulate that immune system and do all of these things, we see these symptoms just melt away. Now, the sooner you treat any of these conditions, the quicker you're going to see improvement. If someone has had their symptoms for 2 months and you can treat right away, it's much, much easier to reverse those symptoms completely than someone who's had it for 12 years. But we do see even people that have had it for 12 years see major improvement and major quality of life improvement, and many of them become 100% well. They may have to work harder, it may take longer, and that's always our goal, is 100% remission and healing. So the path to healing, I've laid it out here in many steps. So I'm just going to review this, and I'm going to only focus in on a few of the steps because Some of them, we just don't have time to get through everything, and some of them are a little bit more self-explanatory. But, first, the healthy lifestyle. We need to be breathing clean air, using air filters and things like that, the appropriate good ones. We need to be eating, organic, whole foods, not sprayed with pesticides, not laden with sugar. We want an anti-inflammatory choices. So for most people, that's going to be gluten-free, dairy-free. Sometimes an autoimmune paleo diet can be really helpful. Even a ketogenic diet can just be miraculous, or a GAPS diet. Can make a difference as a healing period. Most people don't need to be on these specialty diets forever, but some do to feel well. But our goal is to get the underlying root causes treated so that you don't have to, be so restricted for a long time. But it really, really does help the healing path. In fact, the people that get the healthiest the fastest and totally heal are always incorporating healthy lifestyle and diet, movement, having quiet time in your day, sleep, sunshine, love, joy. All of those things are so important to healing. Healthy living environment. So we want that to be chemical-free, mold-free, EMF-free, or very much reduced, natural daylight, calm and structured. A lot of times when we have a chronic illness, our lives get to be pretty chaotic. Our households get to be pretty chaotic. And it is hard to heal in that environment. It's possible, but it's harder. So hopefully there's someone in the household that can create that calm, structured kind of environment to help with healing in addition to the other environmental factors. Help with calming, kind of the third step. So if your brain is inflamed, if your body is inflamed, you really need to bring down that inflammation so that you can start feeling better, so you have the energy to do the next step. So things for calming for people that are more upregulated or agitated or irritable or things like that. Microcurrent neurofeedback, which is a very special kind of neurofeedback that we have at Newbridge. I don't know of anyone else in Minnesota that has it, and it works quicker and in a shorter time frame than traditional 19-channel QEEG, although we do have that as well in our office, and it works for different things. Excuse me. But that breaks up low amplitude delta, and it really has a profound effect on PANS, ANS, chronic Lyme, autism, etc., anxiety, depression, OCD. Cannabinoids and CBD work great for bringing down inflammation. It's probably my favorite supplement to help with calming and inflammation is CBD oil. So you want to go with organic, you want to go with ones that have been tested for mold. There are many CBDs on the market, even well-known quality brands that when they're independently tested come back for mycotoxins or mold. So there's a few brands that we have vetted that are better that way, and we do have them in our office if people are interested in that. But you want to get high quality non-hexane extracted CBD, and you can dose that anywhere from 25 to 100 milligrams per dose, or higher. Really, for the CBD that you can get over the counter will never have too much THC in it to cause a problem. So you can use as much as you need to until things are calm and inflammation is down, and then you can reduce the dose, because it's expensive and you don't want to have to, be doing it if you don't need to. Frequency-specific microcurrent, which we'll talk about later, supplements, homeopathy, craniosacral therapy, which helps you drain toxins from your brain and nervous system, can really help with calming and inflammation. One of my most agitated patients that I've seen, I just, every time he came in, he would be, hitting, fighting, throwing things, scratching, spitting, just like so out of control. I had Denise, our occupational therapist, start to see him and did craniosacral on him and some MRI. And, by the 5th visit of her seeing him, he came into the clinic. The next visit, he sat down at the table. He started working on a puzzle. He was polite. He answered my questions. I couldn't believe it. So craniosacral therapy is great. And Denise Pike, who is in our office, she's an occupational therapy. She's I think she's the best in the 5-state area. She's amazing. So MNRI is musculoskeletal neurologic reflex integration. There's a lot of people that benefit significantly from that, because when you're sick, your reflexes are either not integrated many times, or some of them aren't, or you never gained the reflexes that you should have gained during development. And this resets those. And as much as nutrition is a foundation for healing, getting your reflexes integrated on the therapy side is, the other major foundation for healing for a lot of these individuals. Good for adults and kids, and good for anyone who's had trauma also. Procaine and neurotherapy can be great for people that are old enough to handle some subdermal injections. That's using Dr. Klinghart's method, or a lot of German physicians use this. We do that in our office. Ketamine lozenges or other ketamine, can be helpful for people that are really inflamed. CBD for reducing inflammation, curcumin, fish oil, frequency-specific microcurrent. We have a special frequency-specific microcurrent program that I developed for PANDAS. We have others for Lyme, for mold and mycotoxins, for PANS, for a lot of the issues we deal with. Some resolvins, broccoli seed extract, also really helpful. But trying to figure out what works for you or for your child or for your patient. So not everybody responds to the same anti-inflammatory supplements or treatments. We also need to focus on repairing and strengthening the immune response. So gut healing, detox, low-dose immunotherapy, low-dose naltrexone, IVIG, plasmapheresis. This immune part of it is a part that I think gets missed a lot. If people are just focusing on treating the infection and they're not modulating their immune system, we don't see as complete of healing. So this immune modulation we'll talk more about later, but it's one of the hallmarks and keys for actually getting better and putting this behind you and not relapsing. So accurate diagnoses and identifying infections, really important. A lot of times people come in with just partial testing. They think that their main issue is a particular infection when they've really missed a whole slew of other infections that are also present. And I do find that, bacterial infections, spirochetal infections, viral infections, fungal infections, parasitic infections, there's so many different infections that can influence. And we do lab testing. We also do applied kinesiology and ART testing to help us figure this out. Because sometimes one method won't give you all the answers, and you may need to dig deeper and do more specialty tests, more functional tests, more esoteric tests, or you might need some ART or that sort of thing, muscle testing to help you kind of figure it out if you need to go in that direction. I find a great correlation. My lab tests match up with my applied kinesiology test, so I have come to trust it and find it's really helpful. Treating infections. So antibiotics have a place in this care, but herbal antibiotics also have a place. So we don't always pick one or the other. We like to partner with our patients to figure out what is the best for them. What have they tried in the past? What haven't they tried? How is their microbiome? Whenever we can, we prefer to do it in the most gentle way or using antibiotics during the shortest period possible. But ultimately, we're going to do whatever it takes to get the patient better. We do have the option in our clinic of doing intravenous antibiotics if we need to. We can, for neurologic infections, IV antibiotics are far superior to oral. And sometimes you don't need a lot. I recently had a patient who is 15. She had gotten very ill. She had been at a cabin, didn't know she had gotten bit by a tick, but she did. She had sudden onset OCD, hallucinations, anxiety. She was put in a mental hospital, which none of the psych meds or mental health treatments worked for her. And she's been through, hell and back. But luckily had very persistent parents who, sought out like everything they could to figure out what's going on. And she came in and did 5 days of IV Rocephin, and her OCD and hallucinations and anxiety were gone. And they haven't come back yet. She's now transitioned to oral herbs and low-dose immunotherapy and, some other treatments, and she's still working on fatigue and some other things, but her mental health, symptoms are gone. Now, we got her just a couple months after this started. So, she, luckily we were able to get her started, more quickly, but her psychiatrist was amazed. And, she's doing great now. And I believe she will fully recover. But you have to make sure you're doing the right thing to get the infections. Many of my patients don't need to do antibiotics and they can just do herbs. Herbs are much gentler to the microbiome. They don't damage the microbiome. That's going to reduce your risk for obesity, mental health issues, autoimmune diseases in the future. Very good research. Prolonged antibiotics aren't good for us, but sometimes they're needed. Now, we have a lot of hope in this effect from treating infections in that we have disulfiram now. We've been treating with disulfiram for a few years at Newbridge, at first with the adults, and now I'm doing many more children. I wanted to make sure it was safe in adults and figure out what methods work the best before I started doing it with kids, but now I'm comfortable and we are offering it as low as age 10 currently. So this allows us to get patients off of their other antimicrobials, save their microbiome, get them on a shorter term treatment, which oftentimes, can be as little as, 3 to 6 months, and ramping up very, very slowly using extended release or other formulations that are helpful. But we have a lot of people that have done really well with that. One patient that particularly comes to mind right now is a young man who was in a institution, basically like a group home kind of institutional setting, because he had gotten so aggressive and so irritable and just not functioning, and a lot of conflict in the home. So he had to move out when he was in high school and was on chronic antibiotics, and as soon as he would go off, he would relapse. And he came to see us and we were able to get him on disulfiram, and he just finished his first year of college. He lived independently in the dorm, able to get out of the group home he was in, and his brain fog is gone. He's completing his homework without a tutor. He's doing amazing, and disulfiram was fully responsible. So disulfiram is something, if you have Lyme or haven't heard about it, you may want to check into that. It's a powerful treatment. You have to do it carefully because it can have side effects, but if you're using the appropriate strategies and supports, we find that people tolerate it really well. You have to make sure, number 8 there is closing the blood-brain barrier. So you have to make sure that you're eliminating all of the things that can cause that blood-brain barrier to be open. After our first 2-3 years of life, when the blood-brain barrier is admittedly leaky so that the baby can get the immunoglobulins from breast milk and all the nutrients and things like that, at that point and the preschool years, toddler years, that blood-brain barrier closes, and it should remain closed our whole life. If you get a concussion, it will open up. If you have gut dysbiosis or a dysregulated microbiome, it oftentimes opens up. There are other things that cause it to open up as well, which we'll discuss later, but electromagnetic field radiation is published in literature to open the blood-brain barrier. So again, I think that EMF has a bigger role than we would like to think in terms of opening the blood-brain barrier and causing some of these infections and toxins and antibodies to cross into the brain and cause some autoimmune attacks in susceptible individuals. So we do have to heal the gut, we have to treat concussions, we have to decrease EMF exposure and other factors that can influence the blood-brain barrier. Detox is really important. I've alluded to the fact that, you have to figure out all of the toxins, whether it's just, whether it's mold toxins, whether it's mercury, aluminum, glyphosate, pesticides, herbicides, plastic-based chemicals. If someone has poor detox pathways genetically and they can't detox and they're loaded up with toxins, they're not going to get better fully until you address that part as well, because the immune system will just be too suppressed. We need to do some brain retraining oftentimes, especially in our mold patients who get very, very sensitive and their limbic systems get very dysregulated, and they get exposed to a whiff of mold somewhere, not enough to really make them sick, but their limbic system thinks it is enough to make them really sick, and their body physically goes into this significant emergency response and they can't function. And so we see this in many different conditions, but neurotherapy can help, microcurrent neurofeedback in particular, frequency-specific microcurrent, vagal nerve stimulation, working with occupational therapy to do different things that can help the limbic system and help the vagal nerve, and other things can be really, really helpful. Once someone is treated and they're doing well, this happens so many times. We get people to 100%. And then they kind of go back to their old lifestyle. They start eating poorly. They don't, keep their immune system supported. They get into bad habits. They get exposed to new infections, and boom, they're back where they started. So we want to prevent regressions. So we do recommend for the first year after your last exacerbation or flare, that people be on prophylactic antimicrobials of some sort or another. Once you've had 1 year of no flare, then at that point we can start weaning off more. And hopefully you're on low dose immunotherapy, low dose naltrexone, maybe you've had IVIG or plasmapheresis or something else that can, help reset that immune system response. I find that most of my patients are fine on low dose immunotherapy and low dose naltrexone. It's only a minority of people that need to move on to plasmapheresis or IVIG. I do write for IVIG in my office, and we arrange for it to be done through a home care company. But insurance covers it much better for pediatric patients. It is possible to get it for Lyme patients and ANS patients, but PANS and PANDAS patients, because of a law that was passed a couple of years ago requiring reimbursement for it, has a much easier time nowadays, even though it's still a struggle and a battle to get it covered. But that can be helpful if the other things aren't working. There's some people that have what's called the cell danger response. So that's where your body has experienced a threat or a danger. And in most cases, kind of like the tiger with the caveman gets exposed to the tiger and goes into the fight or flight response, runs or fights and beats the danger. After you're away from the tiger, your body is supposed to go into rest and digest mode. It's supposed to stop the alert response and the panic. What happens with PANS, ANS, chronic Lyme oftentimes, autism, many other disorders, autoimmune disease sometimes, that cell danger response never turns off. When the tiger is gone, the response is still on high mode, and that is horrible for our body and healing. So for people that have that activated cell danger response, they need to turn that off. And there's many ways to try to do that. There's more research happening all the time. Suramin is a great way to do that. We do have a Suramin LDI, or focusing on the cell danger response, called the CDR. And different therapies can help with that too. But it's an area of ongoing research. Robert Navio has some great research in this area, and is an important part of the healing process for some patients. Calming the limbic system is very important. So there's the dynamic neural reset system, Gupta, brain tap, meditation, many other things can help with this. But I find that most of my really critically ill chronic patients need to do some limbic system retraining. So in fact, I've had some patients where we've done everything. We got rid of, they sold their home, moved into a new home, got out of mold, they EMF proofed the house, so they put in all wiring, they did the copper sheathing, they blocked and shielded and did everything they needed to. We treated the infections. We had positive tests originally, went to negative. Applied kinesiology was positive originally, went to negative. Did all of the right things. Did the LDI, did the LDN, did something, because some cases hyperbaric or IVIG or whatever. They dealt with their trauma, they dealt with their, everything was done. Their nutrition was great, their gut microbiome was great, we got the toxins out, we got everything done, but they still weren't better. The thing that has helped them is doing the limbic system retraining. So if you have done all those things and you feel like you've addressed all those other things and you're still not better, or your child is still not better, consider doing some limbic system retraining. And then the last step is repairing any damage. So sometimes, you've had atrophy. Your brain has been attacked by these autoantibodies, and you got to somehow work on fixing that, or your joints have experienced damage. Sometimes stem cells are needed. That is an emerging field and an area where we're getting a lot more information, but something that's still not totally defined at this point. But I've had some patients do stem cell treatment and done very well with that. Pulsed electromagnetic field therapy, frequency specific microcurrent, peptides, many other things can help with that repairing damage, plus just all of the lifestyle and good support that we've talked about already. But when you can do that, you can really move beyond PANDAS and PANS and ANS and chronic Lyme. So that's very complex. I apologize, it was long, but healing complex chronic illness is it's a journey, and so there's that path we have to follow to healing. So I'm not going to go into great detail on this. I could speak on this topic all day long. I'm sure that you guys have all better things to do this evening, and I want to leave some time for question and answer. So I have a lot more slides to get through. So I'm going to not go over everything, because I've spoken quite a bit about the mold and mycotoxins. One thing I haven't spoken about so much in terms of healthy environment is allergies. Allergies and mast cell activation are made worse by seasonal allergies, by certain foods, by mold, histamine sensitivity. Lyme and mold create histamine. Parasites can do the same thing. If you have high histamine, if you have hives, if you have strong allergies, if you feel better on an antihistamine, you might want to look into mast cell activation disorder or, high histamine levels. We can order blood tests to help you with that, to kind of sort through that. There's a great book by a physician that used to be at the U of M, who's kind of the world's expert in mast cell activation disorder that we learned from when he was here. And we taught him some things too about integrative approaches, those of us in the community here. So there's a lot you can do for mast cell activation disorder. Electromagnetic fields we've talked already about, and I do find that for really chronically ill people, they won't get better unless they get rid of mold and reduce the EMF. So it is a hard thing to deal with because sometimes there's a lot of resistance met from family members and things, but it's really important to do that for healing. I've had some patients that had chronic seizures until they EMF proofed their house, and as soon as they got that done, the seizures went away. I've had kids with autism that moved out to the woods in the summer when they didn't have school, no EMFs, no TV, no nothing. Their autism got 70 to 80% better just getting out. So it is more important than a lot of people think, but it's not the only thing. It's just kind of one part of many that allows your body to heal. Stress is another piece that's super important. It can be as toxic as any toxin. And we really need to figure out how to get into rest, digest, parasympathetic mode and not in that fight or flight sympathetic mode. So many of us adults are always in a sympathetic overdrive, got too much to do, always busy, never get a break. If you're a parent of a child with special needs or with PANS or ANS or PANS or PANDAS, you certainly understand this. And many of you adults that have chronic Lyme or other, complex chronic illness, you know what stress is. It's something that's hard to get away from sometimes, but it is really important to do that, to get out and walk around the block, to get out in nature, let your face see the sunshine for 5 minutes, even out of a day. Go forest bathing in the woods, just go and sit in the woods for an hour with your tick prevention. We don't want you to get a tick bite, but get out in nature. Time in nature is very, very healing. You get a lot of negative ions when you're in nature. They've done studies showing that in the COVID, wards, the people that when the hospitals were overflowed, the people that had to be treated outside on a, outside makeshift hospital got better faster than the people in the hospital, even with the same level of illness in different countries. Exercising outside has been studied to be more beneficial to the body than same type of exercise inside. We all really need to be out in nature a lot more and de-stressing. We've talked about heavy metals and toxins. We want to make sure that our environment doesn't have those. So I live in a really old house. I love it. It's a great historic house and a great neighborhood, but we had lead paint. And so we had to make sure everything was painted really over well and that the windows and doors were replaced so that we weren't, every time we opened and shut the doors, we weren't getting lead dust, making us sick. And so you have to take special precautions depending on the age of your house. New houses have more formaldehyde and chemicals. New houses aren't necessarily better, but more mold sometimes because they're too tight and there's moisture and condensation. So chemicals, herbicides, and pesticides are super important. I am doing a year-long fellowship in environmental medicine through the Environmental Health Education Institute. And, I knew a lot before, but I'm going deep dive into kind of how to treat all these things and how to help clear them from our bodies, because toxins are really the source of most disease, or at least the breeding ground, what can predispose you. We've talked a lot about mold and EMF, so I'm not going to talk more about that, but I am going to talk about EMF exposure during pregnancy and early childhood. So here you see this pregnant mom with a laptop right on her, lap, right in front of her belly, this child with a tablet, luckily the child's at a table, so it's not sitting on her lap. Most of the kids that I see are using them right on their lap, but that's a lot of exposure. There have been studies done of women while they're pregnant, and they've had to wear these little radiation tags that measure their electromagnetic radiation, their electrical field exposure, all as satellite radiation, microwave radiation, etc. And they track the kids into childhood. I don't know how old the study went up to, but until the kids were quite a bit older. And they measured the women that had the highest EMF exposure during pregnancy. And then they looked at their children's health outcomes and diagnoses once they got to be school age. And they found that the kids with the higher EMF exposure in utero had higher asthma, allergies, ADHD, autism, etc. So we know that this isn't good for us. The research is getting more and more plentiful, every year. I attend the electromagnetic radiation conference for medical providers the last few years, and every year the research gets stronger. We know that this exposure causes gliomas, certain type of brain cancer. We know that it increases the risk, increases autoimmune markers. We know that it increases the risk of diabetes. One study that was shown at the study in the last year or two was, mice that were exposed to radiation versus the same genetic type of mouse with the same diet, same exercise, not exposed to radiation, had much higher blood sugars, the radiation exposed mice than the mouse that's not exposed. So this has a huge amount of implications for us. More autoimmune blood markers in the mice exposed to radiation compared to those not. So it is a public health issue that we need to be dealing with. And if people are interested in learning more about this, I teach a class every couple of months or so at Newbridge. You can go to www.newbridgewellness.com, go to our classes and groups, and you can sign up for any of the classes or groups there, patients or non-patients alike. And feel free to share them with your friends. Our goal is to get this information out to people and help people heal on their healing journey, regardless of their ability to do, out of network, specialty medical care. We really want to make this information affordable and accessible and help people heal. Lots of research here on electromagnetic radiation contribution to autism. The same thing would apply to almost any chronic illness. Here's a study on the non-thermal microwave lower frequency electromagnetic fields, which are what comes from cell phones and things, how they act via voltage-gated calcium channel activation. So that's activating those calcium channels, which can cause deleterious effects for our brains and mental health. So the third step on the healing journey is just calming and self-regulation. I'm just going to highlight frequency-specific microcurrent here, because frequency-specific microcurrent is an amazing tool to help bring down inflammation, help with pain, injuries, other bodily dysfunctions for both the brain and the body. And each tissue in the body produces electromagnetic energy that resonates at a certain frequency. And when the cells in the body are injured or diseased, the vibrational frequency of the electrons is disrupted in that tissue. And this is what happens in PANDAS, ANS, chronic Lyme, etc. And we use FSM to match the specific frequency of the tissue involved with the presumed condition. And we deliver 2 channels of microcurrent therapy, which decrease inflammation or increase vitality in those tissues. And we have developed specific autism and PANDAS protocols that have really helped kids and adults get out of flares, calm down, increase their parasympathetic nervous system, get out of fight or flight, sleep better, have better bowel movements, increase vagal tone, treat their Lyme, etc. It's not a standalone treatment for Lyme or strep or anything else, but it's a supportive treatment that can get people better. If people are having a PANDAS flare or an ANS flare or a Lyme flare, you can come in and get frequency-specific microcurrent along with molecular hydrogen and or pulsed electromagnetic field therapy. And people just start feeling better. So the molecular hydrogen is just, you wear a nasal cannula or a mask and you breathe that, and it reduces oxidative stress and inflammation. And we usually pair that up with the frequency-specific microcurrent or the pulsed electromagnetic field therapy, and oftentimes red and near infrared light therapy. And that combination can be really helpful. So supplements that can help if you don't have access to all these other good things that I just talked about: CBD, 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 CBD. So CBD, you can tell I like CBD. I don't have stock in any CBD companies. I just find that it's one of the most helpful things to downregulate inflammation in the brain and the gut and help people cope and heal until we can get the underlying infections treated and their immune system modulated and the toxins cleared out so they can actually heal. So magnesium is good. GABA helps decrease glutamate in the brain and can be very helpful. Pharma-GABA is a slightly more bioactive form of that. The magnesium that's best for the brain is the magnesium threonate. Magnesium glycinate or taurate or malate might be good too. I'm not a big fan of magnesium oxide. Doesn't really do much for the body. Might make you poop, but it's not going to do anything else. Magnesium citrate will make you poop too, but it also does other good things, but you can't take a lot of it because you'll get diarrhea. So I do recommend more of these other forms of magnesium like glycinate, taurate, malate, and threonate. L-theanine and 5-HTP are great for anxiety and depression, increasing serotonin. Phosphatidylserine and phosphatidylcholine can be very helpful, inositol, lithium, and much more. Procaine has a place, and we find that can be really helpful. Dr. Klinghardt believes that resets cell-to-cell communication, which is involved in the cell danger response. I find it's really helpful. We can do that by neurotherapy, IV, lozenges, different methods. Other therapies that can be helpful, in addition to what we've already talked about, would be emotional freedom technique or tapping. Seems like it's so simple, it's easy to learn, but I've never had anybody who's actually, done it with me or gone to a therapist to learn it and practice it regularly has not found it's been helpful. At the VA, they did a study looking at anxiety and depression and post-traumatic stress disorder in veterans, and they did 6 sham treatments where they did tap on the acupuncture points and just tapped on different points versus tapping on those acupuncture points. 6 sessions with the therapist of tapping resolved the majority of the post-traumatic stress disorder and anxiety and depression in the veterans involved in that studies, and that was done against a placebo-controlled trial. So we do have a lot of research published on the benefits of tapping. Meditation, yoga calm, acupressure, color puncture, so many things. We do needleless acupuncture in our office called color puncture, using light and lasers and acupuncture points. I'm going to just briefly talk about adverse childhood events, because we're talking about calming and limbic system activation and trauma. We can't not pay attention to the ACEs study. So this was a study conducted by Kaiser Permanente and the CDC. There were 17,500 patients recruited between 1995 and 97. And they've been in long-term follow-up care since then to examine the long-term effects of adverse childhood events of childhood on the physical and mental health of those individuals over time. What they found is that 67% of adults have been exposed to adverse childhood events. This might be yelling, excessive yelling in the home, poverty, homophobia, bullying, sexual abuse, death, emotional abuse or neglect, financial stress. Many different things, can be a cause of an adverse childhood event. Some of them are bigger and some of them are smaller, but early life stress is associated with early onset of chronic illness. I do believe that it predisposes to the development of PANDAS, PANS, ANS, and chronic Lyme. Just one more thing kind of going against you. The study from Kaiser has shown that there's early death, more disease and disability and social problems, adoption of high-risk behaviors, social, emotional, cognitive impairment, disrupted neurodevelopment, all stemming from adverse childhood experiences between ages 0 and 4. So if you have had adverse childhood events when you were younger, you would really be helped by working on those and helping clear those and acknowledging those and working to have those not affect you. If you have children that are between 0 and 4, do the best you can to avoid having exposure to adverse childhood experiences. And if your kids are kind of older than that, they can be affected too. It's not that there's a magical stopping period at age 4. It's still a problem after that, but that early period is just the most important. And just more, data here on the emotional trauma and the effects of that from ACEs. It's also more the more you have. If someone has 4 or more adverse childhood events, they have 11 times the level of intravenous drug abuse. If they have 4 or more, they have 3 times the level of lung disease or adult smoking, 14 times the number of suicide attacks, 4 times as likely to have begun having sex before age 15, 4.5 times more likely to develop depression, 2 times the level of liver disease. It goes on and on, but dealing with these adverse effects impact our, mental and physical health. So how do we address and heal from adverse childhood effects after the fact? I think it's really important to address any emotions and past traumas as you work on healing the neuro, gut, immune, endocrine, interconnected system. That's really critical to healing. There's a really good book called The Body Keeps the Score by Bessel van der Volk. Amazing book that talks about all of this. So good book to read and understand and help with healing. And then there's a lot of therapies that can help clear and help people be more resilient and not having these adverse childhood events affect them. I have found that counseling is really helpful to help people identify their adverse childhood events or their trauma or their problems or their relationship issues or whatever they're dealing. But I find that counseling on its own is not a fast way to deal with some of these. EMDR is a rapid eye movement desensitization that I find works a little faster. It's not enough for everyone, but it seems to be better or good if it's paired with counseling. A lot of psychologists perform that. And then there's a lot of kind of complementary alternative things that I personally have found to be extremely helpful and have moved people much, much faster to full, wellness and clearing of some of this trauma. Shamanic breath work, family constellations therapy, life system assessment and biofeedback, which we offer in our office, where we clear and harmonize related energetic frequencies, applied psychoneurobiology using the Klinghardt method, neural therapy, chemotherapy, QNRT, ketamine-assisted psychotherapy, and many more. But the key I'm trying to make here is if you or your child or a loved one has had adverse childhood events or any trauma in your life, really important to make sure you don't sweep that under the rug, that you deal with it, because you may be holding that trauma in your tissues, and that might be preventing your Lyme or strep or PANS or PANDAS, et cetera, from actually clearing and you or your child becoming well. So reducing inflammation is important. We've talked about CBD oil. High-dose fish oil can be helpful. Camel's milk actually is very, very helpful. It has antiviral, antifungal properties. It's immunomodulating. It's great. Curcumin is a great complement to that. So there's all these natural things that are too many to talk about here, but there are cases and times when we need to do steroids. We need to do ibuprofen or Aleve. If you do ibuprofen or Aleve too long as the non-steroidal anti-inflammatories, you can get gastritis and ulcers, and I've had patients in my practice that's happened to. So I don't like people to just be sucking down ibuprofen and Aleve forever. I kind of say do it around the clock for 2 weeks and see if you feel better, see if your child feels better, see if your child's acting better, see if you are acting better. If you're seeing that, inflammation is really important. In some cases, we've had to do steroids because, the person had to get on an airplane to go to a funeral, or, they had to, be present for a family wedding, or the kid was just punching holes through the wall, and it was that, or be admitted to a psych hospital. So there are times when steroids are needed, but they do suppress the immune system and allow infections to flare further, and there are side effects, behavior issues that sometimes people experience when they're on them, and other longer term effects that we don't like. So we try to keep them to like a 5-day burst if we need them. Intravenous is really powerful, but oral is oftentimes enough as well. So there's some good availability for that when things get really bad if needed, but it's not our first choice. We have to really repair and strengthen the immune response, and gut healing, detox, low-dose immunotherapy, IVIG, low-dose naltrexone, peptide therapy, plasmapheresis. Those are all things that are super important in repairing that immune response. And if people don't get that immune response repaired, if they don't modulate that autoimmune reactivity, I don't find that people get better forever. They might get over a flare, but the next time they're exposed to another infection, same old thing is right back again. So, so doing that LDI, doing that low-dose naltrexone, if those aren't enough for you, moving on to the IVIG or the plasmapheresis, peptide therapy has been something newer we've added in the last year that has been really helpful. Those are really important. So I'm not going to go into great detail on low-dose naltrexone because one of my colleagues, Tara Kalmas-Norgard, spoke a few months ago on the topic. So if you are interested in some of these therapies, peptides, low-dose naltrexone, ozone, different things, you may want to watch her lecture. But I just had these slides in here. So low-dose naltrexone is great though. Low-dose immunotherapy we have found to be amazing for our Lyme and PANDAS and ANS ANS, PANDAS, and Lyme patients. I may offer to come back and do a whole lecture on this because I can't really do it service by just a couple of slides, but it helps to reset the immune response, turn off that autoimmune response, turn off that allergic hypersensitivity response, and modulate that immune system by educating the T regulatory cells. It's a sublingual drop that you do under the tongue, just a small amount of fluid containing an ultra diluted minute amount of the antigen, killed, of course, in the case of infections that you're sensitive to, and it's taken only every 7 to 8 weeks for a period of time. You do have to have inflammation down and have gotten some microbials on board to be able to tolerate it. If you're eating a really inflammatory diet, if you're really inflamed, if you haven't killed, your infections or, done that, you have to kind of do a little bit of that first. Otherwise, you're going to have a big reaction to this. And we don't want people to have a herx or flare. So sometimes we have to do some prep work before people can get on the LDI. Treating yeast and being on vitamin D before you start is really, really helpful. So basically, if you've been sick for a long time and you haven't gotten better, I would consider adding LDA and LDI into your regimen. It's not usually what I find on its own. There are some people that go to other practitioners that like all they do is put you on LDI and they don't do anything for your infections. They don't do anything to treat your gut microbiome problems or your mold or your EMF or your toxins or your stress or your trauma or anything else. And I don't find that a lot of people get better if they're not doing it as like a package. But if you've done all the other stuff and you haven't tried LDI and you want to try it, you can come in for LDI only, or maybe you see another practitioner who's helping you with everything else, but they don't do the low dose immunotherapy. We can, help people just with the LDI. So, if you're interested in any of our services, you can go on our website and fill out a new patient welcome form and just explore, find out if it's a good fit for you for our IV therapy, for any of our alternative, complementary therapies, or for traditional, functional medicine, integrative, Lyme literate, PANDAS related care. So I'm not going to really talk more about this because it's already 8 o'clock and I want to leave time for questions. So frequency specific microcurrent, talked about that already a little bit. It is amazing. There's 30 or 40 published papers on it. The Cleveland Clinic in Ohio uses it. We use it for kids and adults. We have a big program. We have like 6 different machines that we can run you on 5 or 6 different, machines at once. So you can be getting emotional frequencies if you need that. You can be getting your physical ones, your calming ones, kind of at the same time, so you get a faster treatment. But a lot of times people end up renting or purchasing these because it is really best used if you do it regularly at home. So I'm going to skip over that. We have to identify the correct infections. I think I've talked about some of that already. And with this, it's testing, the household, if one person has strep, they might be giving it back to each other. You want to make sure that you've gotten everything, and everyone kind of cleared. The fungal issues are something that I haven't talked too much about, so I'm just going to spend a moment on this. Candida and mold, aspergillus, all of these fungal varieties can wreak a lot of havoc for people. If you have candida in your gut, you can have leaky gut because of that. We talked about babies exposed to mold in utero and how that can be a huge issue. High carb, sugary, starchy, refined food diets feed yeast. Yeast loves sugar and white flour. The good bacteria in our bodies like vegetables, vegetable fiber. So we need to all be eating a lot more vegetables and vegetable, fiber, plant-based things, less carbs, sugar, starch, refined foods, because then we're feeding all of the enterocytes in our gut and we're going to build a healthier immune system and we're going to be able to heal. We're not going to be feeding our infections. So all that flour and sugar, refined stuff is feeding our infections. We need to starve them out and, that'll help the other treatments work better. So really important to deal with these fungal issues. Sometimes people have been on massive antibiotics, herbs, things like that. Their yeast can get overgrown and no one's ever treated their yeast. No one's ever treated their mold that maybe they had or their mycotoxins. So treating with herbs or, or antifungal prescriptions, really helpful. We are seeing big breakthroughs with using Sporanox in our patients. There was a published study by Dr. Sidney Baker, who's one of the grandfathers of functional medicine, on a child with autism who totally reversed his autism doing high dose Sporanox, which treats mold and fungus. And that resolved his autism. He hasn't relapsed and he's been off of it for many months now. And it's not just autism that can benefit from clearing yeast and mold out of your body. So something to look at. Closing the blood-brain barrier is really important. I talked about that earlier on what causes the BBB to be opened, but we do need to close it in order to heal adult autoimmune neuropsychiatric syndrome associated with infections and the pediatric version of that. Because the blood-brain barrier doesn't let the large molecules like the antibodies through if it's tight. You know, and soluble molecules that are low in lipids don't cross the blood-brain barrier very well. And the lipids is where we store a lot of our fat. And so lipid soluble molecules rapidly cross the blood-brain barrier in the brain, which is why the high-fat diets are so helpful. So ketogenic diets, high-fat paleo diets, and I'm talking about avocados, nuts, seeds, olive oil, you know, healthy fats, grass-fed beef, you know, well-cut salmon, olives, you know, avocados, things like that. If you have a high-fat diet, your brain is going to get better faster. If it's the right fats. Now, you don't want trans fats, you don't want chips, you don't want French fries, you don't want those kind of fats. You want the healthy fats. So molecules that have a high electrical charge are slowed or blocked by the blood-brain barrier when it's working well. But when it's leaky, you know, all bets are off. You know, everything can get in, and then we have more brain disease. So we want to get that blood-brain barrier strengthened by preventing foreign substances from crossing, protecting the brain from hormones and neurotransmitters that are not supposed to cross the blood-brain barrier. We need to kind of maintain that constant environment for the brain. And so we have to heal the blood-brain barrier in order to heal PANDAS and AANS. It just, you know, autoimmune encephalitis, we have to heal that. And part of healing the blood-brain barrier is healing the gut barrier. So a lot of people are like, why are you talking to me about diet and gut healing? It's my brain that's the problem, you know, or it's my joints that are the problem, or, you know, whatever it is, my OCD that's the problem, my anxiety. You can't heal the blood-brain barrier until you heal the gut barrier, and vice versa. So they go together, and you kind of do both. So we already talked about some of the things that can contribute to the blood-brain barrier, so I'm not going to go into that. Gluten is a big one, in addition to the others that I've talked about. Detox, I think, needs to be its own talk. It's a huge issue. We can come back and do a talk on detox sometime, but there's a lot you need to do for detox. One of the simple, basic things that you need to start with is make sure you're clearing your bowel movements every day. So here's a homework assignment for everybody. I want you to take, you know, smaller amount of seeds for a child, larger amount for adults, but anywhere from 1 to 3 tablespoons of a seed that's not going to digest, like a mustard seed or a golden flax seed or, you know, sesame seeds or something. Mix it with a little bit of water, or, you know, put it in your mouth and swallow it with some water, mix it in a little applesauce, and then watch to see how long those seeds take to clear in your bowel movement. They should clear in 12 to 24 hours, totally. But a lot of people aren't going to clear them for 4, 5, 7 days after they, you know, ate them. So even if it's just 48 hours, it's too long. So if you do that seed motility test and you're not clearing those seeds in a 24-hour period, 18 is kind of the magic number. You need to add more magnesium, fiber, you know, filtered water, triphala. Work on that first. If everyone does that, you're going to detox so much better. And then after that, you can start with a little liver support, gallbladder support. And then after that, when you start killing your infections, you won't have the same herxing. You know, you're going to detox so much better. You're going to feel so much better. Coffee enemas can be great. I know it sounds a little crazy, but it really, I've never had anybody done a coffee enema who hasn't felt amazing afterwards. But balancing your copper and zinc, you know, ratio, fulvic and humic acid, ionic foot baths, phosphatidylcholine therapy, IV or oral. We have great results from phosphatidylcholine therapy for detox, both intravenous and oral. Sauna and sweating, glutathione, NAC, ALA, et cetera, vibration plate and lymph drainage. So many things. Emotional detox is important too, as we've kind of alluded to. So the cell danger response is really important. I think I touched on this before. I'm not going to go into great detail, but here's Dr. Navio's paper. When normal stages of the cell danger response persist abnormally, when the tiger is gone, but you still think the tiger's there, the healing cycle is blocked and chronic disease results. This is by Robert Navio, a brilliant physician and PhD researcher who has published extensively and researching on this topic. So I'm not going to go into the safe danger aspect. I will say that basal nerve stimulation is definitely helpful as part of the healing of this. Our occupational therapy micro and the MRI folks we have at Newbridge are really helpful at working on some of this, but there's many ways to do it. Even just singing and gargling makes a big difference. There's, you know, targeted color puncture, alpha stim, frequency specific microcurrent, all kinds of ways you can work on this. So at the end, we have to repair the damage. So things that can help with that are, removing the barriers to self-repair and adding the things the body needs. If we take away the things that are harmful and add the things the body needs to heal, nutrients, love, sleep, all of the good things that we need, supplements, etc. The body wants to heal. It's going to start moving towards healing on its own. Frequency specific microcurrent, light therapy, pulsed electromagnetic field therapy, hyperbaric oxygen, ozone are all great things for helping repair the damage. Because sometimes we've killed the infection, but the damage is still there, and you kind of repair that damage in order to get fully better. So got to be looking at all of that. We have to retrain the brain, as we've talked about. Peptide therapy, stem cells, other advanced techniques can help with repair. I'm not going to go into peptide therapy because Tara talked about that in her talk, but can be helpful. The thymosin alpha-1 is no longer available, unfortunately, but I usually start with the BPC 157. That I find to be really well tolerated by kids. It's oral as opposed to an injection, and can be helpful. Because the thymosin alpha-1 is no longer available, we're starting to work with synapsin coming out of Australia. That can be a really good option for helping with brain-related and neurocognitive kind of issues. Thymosin beta-4 is still available. That can be helpful for different conditions. More, I would say, musculoskeletal issues more so than brain issues. And then the BPC 157 can be really helpful for gut, brain inflammation. It can be, amazing for lots of things. So craniosacral, I kind of mentioned, musculoskeletal neurologic reflex integration is done by our nurse and our occupational therapist, can be really helpful. Hyperbaric oxygen should be a whole nother talk. I am certified in hyperbaric oxygen and think it's a great modality and can help write prescriptions for people for hard chamber or soft chamber or home use. Light therapy, again, could be a whole other lecture. Color puncture, we have an amazing color puncture therapist named Jenny, and she can do magic, both the physical and emotional things. It's using the acupuncture points and not using needles, but pressure and laser and light and things like that to provide healing. Light therapy and photobiomodulation is amazing, and the color puncture I think is better than regular acupuncture. It's really really amazing. Craniosacral, we've talked about. Ozone, Tara talked in her talk, so if you want to learn more about some of these therapies, I would listen to Tara's talk. We have an ozone sauna and a far infrared sauna. We have ozone insufflation for people who want a quicker treatment, less expensive, not as invasive. We do joint injections for people with joint pain with prolozone, which works much better than steroids and it's much safer. And this is our IV suite. We have 6 beds up there, a beautiful view of our atrium and our solarium. Gets lots of sunshine. Lots of IV therapies. We can come back and talk about all the IV therapies, but we pretty much do any IV therapy that is out there in functional medicine or nutritional therapy. NAD can be great for energy and mitochondrial support. There is the phosphatidylcholine complete protocol, which consists of phosphatidylcholine, glutathione, glucoborin, which is the activated folate, B12 in whatever form you tolerate, sodium phenylbutyrate, and the phosphatidylcholine, the good stuff. There's an inferior type and a really good kind that has a phospholipid bilayer that has both water and fat soluble that works much better in the body. That protocol can be amazing for repairing the blood-brain barrier, for helping with those cell membranes, for clearing toxins, clearing mold, clearing. A lot of people have antibiotics or heavy metals or toxins or pesticides or herbicides, stuck on their DNA. There's these DNA adjuncts that we need to wash off or clear off, and this protocol does that. There's testing you can do before and after to kind of show that. So glutathione, alpha lipoic acid, IV ozone with ultraviolet light, blood irradiation, high-dose IV vitamin C. We do kind of everything. I am not going to do my case study because it's already 8:18 and I want to make sure there's time for questions. So I do have a case study about a patient who did really amazing. I'm not going to go into it now, but the gist of the case study is that mold and Lyme were her triggers for her PANDAS. She did not have strep, but she had PANDAS. They thought it was PANDAS, but it was the Lyme actually. and the mold, which predisposed her to the Lyme, which were her problem. She did have these mold markers in her urine. We used a multidisciplinary approach to treatment. This was her QEEG 19 channel before. You're not supposed to see all that red and all these lines. We look at it eyes open and eyes closed. Afterwards, you can see that's looking much better. And this was after functional medicine care and only 5 treatments with neurotherapy and neurofeedback. And just to be able to see more clearly, before treatment is on the left and on the right is after treatment. And that was after, about a month of functional medicine care and 5 neurofeedback treatments. Major improvement. So granted, she was a great patient. She did everything I asked her to do. Diet, supplements, you name it, she did it. And she responded really well. Her OCD and anxiety responded amazingly well to treatment, and even just the first treatment of the microcurrent neurofeedback, she reported huge improvements. And one of the biggest things we want to do is prevent. So I'm not going to go into it, but it's high tick season out there. Make sure you're using the appropriate prevention when you go out. We have lots of treatment considerations. We really do try to consider, all of them: mind, body, finances, relationships, environment, life purpose, joy, all of those things, because you need all those things to get better. And a really exciting thing I just want to end with is our care circles. We have affordable and comprehensive group healing, and we have an interest form on our website. Chris Neifel, our health coach, is helping us expand this into more adult care. Primarily, we've historically done it in kids with PANDAS and Lyme, but we will be continuing to offer more of those. But it allows people to get community, accountability, resilience, and empowerment in a group of people that are dealing with the same problem that you have. And you get more services, you get more touch points from Newbridge practitioners. You get discounts on all your therapies. You do consultations with the nutritionist. You have health coaching visits. You have functional medicine visits. There's some individual and some group, and lots of discounts and lots of free treatments. So it's a really affordable way to become well if you have a complex chronic illness of any kind. So if you're interested, adults or kids, feel free to fill out our interest form on our website. And these are just some of our amazing team, both functional medicine, dietitian, RN, craniosacral, MRI, color puncture, forgiveness facilitation. So, we are all here to help you and serve you. And we have, another bunch of folks behind the scenes that are also here to support. And I want to open it up to questions. So I apologize that I spoke for so long and so fast, but I wanted to get this information out there. It will be recorded and put up eventually on the website, so you'll be able to watch it again if I was going too fast. But I am very happy to answer any questions that anyone has.
So if you put your questions into the chat, then I'll pass those along to Stephanie. So we do have a couple questions already. One was, could you please flash back to slide 35 with the research on EMFs when we break for questions? Thank you, great information.
I will go up there. So, and these are just some. This slide was one I grabbed from an earlier presentation. So I think it's only up through maybe 2018. There's a lot more. And if you're interested in more of the research, I'd recommend that you go to a couple websites. One is the Environmental Health Trust, EHT. It's run by a PhD who is just really pulling all the research together on EMFs. The Environmental Health Trust, very good website. Just Google Environmental Health Trust EMF and you'll find it. The other one is, that's from America. There's one of Australia called PHIRE, and it's physicians. I don't remember exactly what it stands for, but it's, she's really interested in EMF as well, and looking at it from a medical perspective and pulling research together. Those are really good sites that have a lot of information, all the latest research. And then the environmental, the EMF conference, the electromagnetic radiation conference for medical providers, the EMF medical conference is what it's called. The last couple of years has made their lectures available after the fact by recording. And they are very inexpensive to the general public, and they do have some free ones, available as well. You sign up for their mailing list. So people are interested in this topic. Please check those resources out. We are actually starting a group at Newbridge of people that are concerned about electromagnetic radiation, maybe in their child's school or in your workplace, or want to just learn how to, EMF proof your house. Basically just check our website for our classes and groups. And they're usually, my talks are usually Fridays around lunchtime, but we have other practitioners that speak as well. And we'd love to have you join us.
Can you talk about high levels of copper on blood work, how to treat, and if it can cause OCD in a patient with Lyme and co-infections?
Yeah, so basically, copper zinc ratios are really helpful to look at whenever you have patients with mental health issues. I see them very dysregulated in mental health, schizophrenia, autism, bipolar, PANDAS, ANS, PANS. Pretty much anybody with a mental health issue, I'm going to see their copper elevated and their zinc, lower. We ultimately want to see zinc higher than copper, and we want to see both of them, ideally above 100. So a lot of times I'll see, that people are 70, 80, 50, 60 for copper and zinc. They're so low, they're just not getting enough of either one, usually due to nutrition or malabsorption or gut inflammation or what have you. And high copper, I believe that the body is creating high copper as a defense mechanism, in part to fight infections, because when you raise copper, you increase oxidative stress, and that helps you fight infections. There are some people that have genetics that predispose them to having more problems with their zinc or copper metabolism. But most of my patients, when I treat their underlying infections, up front, they have these really significantly high copper and lower zinc and poor ratios. We treat their infections, we get them healthy. They don't need massive amounts of zinc anymore to keep the ratio in balance, because zinc and copper compete for the same binding sites. You need to give more zinc usually. You do have to be careful to watch the copper doesn't get too low when you do that. So we check from time to time their blood levels and adjust the doses accordingly. But most of my patients they do better on some zinc, but they don't need the high doses once we treated their infections. So the early research done by the Welsh Institute and others, that, certain people just absolutely have to stay on this high level of zinc kind of forever. I don't really find that to be true. They need more zinc than the average person oftentimes, but not the high doses. But yes, they can. That high copper, I wouldn't say is the cause for schizophrenia or OCD or autism or PANS or things like that. It's more a symptom that pops up because of the underlying root causes, in my opinion, for most patients. But if you want to look up pyroluria, cryptopyroluria, there are some good websites out there that go into that and what it is and how to treat it. And we do have a Welsh protocol expert in our staff, Dr. Kathy Dolan. She's really good at helping people figure out what supplements they need to get their mental health symptoms in balance while we're working on the underlying root causes that we've talked about today. I do that too, but she has had a lot of training in that area.
How can you tell if you have cell danger response?
The cell danger response, there's no test you can do to test for it. Usually we see it, if you have a child with autism, your child has it. I've never seen a child with autism who doesn't. But maybe some of the highest functioning kids might not, but most of those kids do. I do tend to find that the toxins can trigger cell danger response. So anybody who's had a vaccine reaction, anybody who's maybe been exposed to, mercury, aluminum, toxins, heavy metals, lead, whatever, and that was part of them getting sick. Mold acts as a toxin that if you've had significant mold exposure, you probably have some cell danger response problems. But right now there's no, and you're not getting better. People that have a good functioning cell danger response get better, after the danger is gone. If you've done all the right things and you're still not getting better, I would strongly be suspicious that cell danger response is altered for you. Read Dr. Navio's paper, Dr. Bob Navio. His paper is, well, he's got a few out there published now, are brilliant.
I've heard that NAC is going to become unavailable. What's the story, and should we stock up now?
Yeah, it is no longer available from my understanding on Amazon and a lot of consumer sites. The FDA, from my understanding, is trying to pull it from the market for over-the-counter use because they want to classify it as a drug. Apparently it was classified as a drug, maybe around the 50s. And I'm not sure the process of how it became declassified, but it's been available as a supplement ever since then. And there's just a plethora of published research on the benefits of N-acetylcysteine, or NAC. And we use it very much in our OCD treatment, helping people create more glutathione. It's a precursor to glutathione, so it can help you detox naturally. It's helpful for respiratory issues, COVID, all kinds of stuff. I will be very sad if it completely goes off the market, but I do think we have a risk of it leaving. We do have some at Newbridge. I do think you might want to stock up on it. I think it may be gone. I don't know for sure. It's not gone yet. I can still get it from my suppliers, although it's been sold out because everyone's freaking out and going out and buying it. So we did buy a bunch from one supplier that hadn't sold out yet. So we do have some, but for OCD and anxiety and just helping with that glutamate GABA kind of response, it can be really helpful. It has been published in the autism field to help with autistic behaviors, and 900 milligrams 3 times a day decreased autistic behaviors, anger, rage, helped improve sociability and different things. I find it's really helpful also in a lot of my PANDAS and AANS patients, and anybody who needs to detox, it's good for. So great supplement. I hope it doesn't go away. Apparently melatonin and methyl B12 are also on the chopping block with it from the FDA. So write your legislators, go into the comment area on the FDA website. These things will keep going away if we don't, stand up and demand that we need to have access. Because my concern is that they're, some people are like, oh, well, then maybe it'll be covered by insurance if it's classified as a drug. Then you have to have a practitioner order it for you, who has to, believe that you're going to be helped by it. It's going to be very expensive once it goes through the pharmaceutical process, and people won't be able to use it. Just everyday people will have a hard time getting a hold of it, and it probably will only be prescribed for, the indications that have, 40 published double-blind studies. So you won't be able to use it for most of the things that we use it for now. So I do recommend that people contact their legislators, comment on the FDA, website when that comes up, sign up for, some of the websites that give you updates on these things, like Natural Health News, other Green Med Info, other sites that'll give you information so you know what's going on.
So worried about DSF when my young adult child already has OCD from Lyme and co-infections. Will DSF send her to psych hospital? Could it be permanent?
DSF. I'm trying to think what that acronym is. Can whoever asked that question just type in the chat?
Disulfiram.
Oh, disulfiram. So you're worried about disulfiram causing more hallucinations or OCD or that sort of thing, because some people have had that. Did I hear the question right? I was so hard trying to think about it.
Yes.
Okay. Yeah. So from my experience with disulfiram, if we can start at extremely low doses and do frequent small doses throughout the day or the extended release and then gradually go up, I have not had any hallucinations, any OCD, any increase in mental illness. It's one of the biggest concerns of my families that I'm talking to about it. But I go slower and more conservatively than most. I'm working with kids and, I need to be more careful. But I really found people doing well. I do require that people go on extra liver support when they do it, because I don't want to have the liver enzymes going up. But I believe that a lot of those hallucinations and mental health symptoms that people have seen when they've done disulfiram result from people starting too high in the dosing too quickly. And it's a result of die-off, related to killing of infections. So if we can kill those infections more slowly, we make sure that their detox pathways are wide open, they're pooping well, their liver and gallbladder are good, their lymph is moving before we put people on the disulfiram. After that's good, then you support their liver, you start very low, and more extended release or small frequent dosing as you ramp up on the dose, and have binders on board to mop up the binding, make sure that people are on glutathione or other things to help escort the toxins out of the body as you're killing. people do really, really well in my experience. But I do a very, very tiny dose startup. I have to get it compounded to be very, very tiny. And we might only start with 1 pill a week, and then we slowly go up from there. I would not recommend that people start with twice a day dosing. We start very low and slow and work up slowly, just so we know what's going to happen.
How high can you go with zinc?
Highest I've had anybody on zinc is probably 150 milligrams, but I know that some patients have to go higher, but that's only if you're getting blood levels checked and working with a knowledgeable practitioner. The great thing about zinc, though, is that if you're going to get an overdose on zinc, you will throw up or get nauseated before you get too much. So the body has a natural kind of checkpoint, release valve warning signal to let you know that you don't need any more. So if you ever take zinc and you feel like you're getting nauseated or throwing up, you might need to take it with food. But if that persists, even taking it with food, you probably are taking more than you need. And so I would stop for a few days until it goes away and then start back up at lower dose and just ramp up to the highest dose that doesn't cause that, and then have your practitioner check your levels.
When you do FSM or other energy treatments on patients, when they go back out into the world bathed with EMF, does it counteract the treatments?
I really like the pulsed electromagnetic field treatment for EMF sensitivity because it is patented to treat what they call as electrosmog. It has more patents than any other PEMF device out there. It's a special system that comes from Germany and was kind of the first one. That system in particular helps you handle more of the EMF you're exposed to after you have a treatment and then you go out there. I sleep on one every night. I have it programmed to go off at certain times while I'm sleeping. I have my kids have them. My osteopenia, I had an area in my back that was really it was hurting for about 2 years. I've had this pain right in the center of my back. The PEMF healed that. My pain has been gone since about 3 weeks since I started using it. And my electrical sensitivity is gone. My fingers from using my cell phone all the time, we're getting hot and a little bit like tingly after years and years of doing a lot of work on my cell phone instead of on a computer with Wi-Fi. And I don't have that anymore. I found that it really has helped me reverse the mild electromagnetic sensitivity that I was starting to get, but I don't want to progress into more severe hypersensitivity because I have a lot of patients that have that. And it's a lot easier to prevent than it is to deal with once you have it. So I do find that the PEMF in particular is very protective. The frequency specific microcurrent isn't really targeting, it will help with the EMF hypersensitivity, but we're using that more to target increasing vitality in certain tissues, decreasing inflammation in certain tissues. And so it's not directly being used necessarily to treat electromagnetic hypersensitivity, although there are some protocols that some folks are working on that might help with that, but it's more geared at emotional and physical healing. But the PEMF can be helpful at reducing EMF sensitivity. Oxygen is helpful for that too, hyperbaric oxygen or other oxygen treatment. Antioxidants are really helpful for that. Pycnogenol, resveratrol, curcumin, broccoli seed extract, all of those are really good for electromagnetic hypersensitivity. So I have one kiddo that is homozygous for that voltage gated calcium ion channel issue, and he actually gets nosebleeds when he gets exposed too much to EMF. He's very irritable. He's very cranky with his siblings, and I can just load him up with antioxidants and, he's much happier. So basically antioxidants reduce the oxidative stress caused by the electromagnetic hypersensitivity, and I highly recommend them.
Just going back to the disulfiram question, what is a tiny dose of disulfiram?
I've started people on as low as 5 milligrams, depending on their age, but, I typically will start with maybe, 15 to 25 milligrams. So pretty small. The pills are 250 milligrams. So if you cut them in quarters, that's 62.5. And I'm starting much lower. I'm dealing with kids, and young adults. I do see some adults in my practice, but mostly I'm seeing the kids.
That's great. Did we have any more questions? I know it is getting late. We have had a number of people thanking you for this great conversation. Several people had to go off to put their kiddos to bed. but lots of great comments about what a great talk this was. A special one, but running off to put the kids to bed, but appreciate all the info. Jenny Lyon, mom of Gussie. So I'm guessing that you must know Gussie.
Great.
So do we have anyone else here before we check off here with questions from Stephanie, for Stephanie? Well, Stephanie, thank you so much. We really appreciate this. Was so informative. I'm sure everybody's heads are spinning with all the information because it was amazing. So we did record this, so it will be up on our website. It will probably take a while. It unfortunately does take a while to get it on our website, but you just go to midlime.org. Under education and resources, that's where our videos are at. And there's another one of Stephanie's videos on there. There's also one from Tara from Newbridge talking about all the peptides and everything. And in September, Dr. Rakota did have a pretty long discussion about disulfiram. So if people want more information about disulfiram, she did a talk on that. We will be here next Tuesday for a support meeting. So we'd love for all of you to join us for that. But otherwise, here's a virtual clapping from everybody for Stephanie. Thank you so much. We really appreciate it. I hope everyone out there stays cool, stays healthy, regains their health, and make sure that if you are going out into tick environments, you still can get more tick infections. So please do be putting permethrin on your clothes, Picaridin or DEET on your skin, and doing those tick checks, okay? So
amen.
Yes, thank you everybody. Have a great rest of your week. And Stephanie, thank you again. We so appreciate it.
Thank you so much. Stay cool, everybody. I gotta go into more air conditioning. I'm hot. So everybody stay cool and thank you so much. Bye-bye.